You've learned what's involved in the 4 steps of first aid. Now, you'll learn how to put them all together in specific emergencies. The topics are arranged into 2 groups. Group A includes illnesses and injuries that have the potential to become serious very quickly, such as difficulty breathing, severe choking, and heat stroke. Group B includes other illnesses and injuries you should be familiar with, such as broken bones, sprains, and nosebleeds. First, we're going to look at Group A. You'll need to act fast in these situations because your first aid actions can make an immediate difference. Severe bleeding occurs when a large blood vessel is cut or torn. When this happens, a child can lose a lot of blood within minutes. Most bleeding can be stopped by applying direct pressure to the wound. No matter what, it's important to stay calm. If you stay calm, the injured child will be more likely to remain calm, and you both may find that bleeding often looks worse than it is.
Hey, Mom, these are cool. So can we get one?
Brandon, are you okay?
Yeah, I swung this and hit that vase.
Don't worry. We know first aid and we're going to help you, all right? I told you to be careful in here. Don't worry. Sam, can you clean up this area of the store and let the other shoppers know to stay clear?
I'm sorry for the inconvenience, but could you please stay clear of the area until we get everything cleaned up? Thank you.
Just put your arm on the counter right here for me, okay? I'm gonna get the first aid kit. All right. It's bleeding, but I don't see any glass. I'm gonna need your help. Put this on the cut and press down while I get my gloves on, okay?
Okay. I'm sorry, Mom.
It's okay, Brandon. I know you didn't mean for this to happen. Hey, things like this just happen sometimes. Okay, all right, let me see. Okay, I'm going to try to get the bleeding to stop, but I'm gonna have to press down hard, okay? You ready?
Yeah.
All right, it's still bleeding through, so I'm gonna add some extra gauze.
Can you take that bloody one off?
That's not a good idea. It might make the bleeding worse. I'm gonna push down harder with this extra gauze, and with a little more time, I think we can get the bleeding to stop. Okay, looks like it's stopped. Let me get a bandage on it, and you'll be all set to go.
Thank you.
You're welcome. Lift up.
Lisa is able to stop Brandon's arm from bleeding with direct pressure and the use of dressings and bandaging. Let's talk about the difference between a dressing and a bandage so that you can understand how they work together. A dressing is a clean material used directly on a wound to stop bleeding. It can be a piece of gauze or any other clean piece of cloth. A bandage is material used to protect or cover an injured body part. A bandage may also be used to help keep pressure on a wound. If necessary, you can hold gauze dressings in place over a wound with a bandage. To stop external bleeding, take the following first aid actions. Be sure the scene is safe for you and the injured child. Send someone to get the first aid kit and AED. Put on personal protective equipment. If the injured child is old enough to do so, ask him or her to put direct pressure on the wound. Phone 911 if there is a lot of bleeding. You can't stop the bleeding, you suspect a head, neck, or spine injury, you're not sure what to do, or you see signs of shock, which you'll learn about in a few minutes. Specifically, here's what to do when you find a child who has a cut or other bleeding. Find the place that's bleeding. Apply dressings from the first aid kit and put direct pressure on the dressings over the bleeding area by using the flat part of your fingers or the palm of your hand. If the bleeding doesn't stop, you'll need to add a second dressing and press harder. Do not remove a dressing once it's in place. This could cause the wound to bleed more. Keep pressure on the wound until it stops bleeding. If you can't keep pressure on it, wrap a bandage firmly over the dressings. Once the bleeding has stopped, if you haven't already done so, wrap a bandage firmly over the dressings to hold them in place. For minor cuts, wash the cut with soap and water and then apply a dressing to the wound. Use antibiotic cream on small scrapes and surface cuts to prevent infection. You'll use less pressure to stop the bleeding for a minor cut or scrape than for a major cut or scrape. Now let's watch a demonstration of what this skill should look like. You'll practice how to stop bleeding and bandaging afterward, so pay close attention. First, make sure the scene is safe for you and the injured child. If necessary, have someone phone 911 and get the first aid kit. Use pressure and gauze to stop the bleeding. If bleeding does not stop, apply more dressings and more pressure. Do not remove any gauze once it's in place. You should be able to stop most bleeding with pressure. After you have used direct pressure and dressings to stop bleeding, apply the bandage over the dressings to keep pressure on the injury, protect it, and secure the dressings. The video will now pause for you to practice controlling bleeding and bandaging. You'll practice using pressure with gauze. Pair up with a partner and take turns being the injured child and rescuer. Your instructor will test your skills after you get a chance to practice.